Welcome back to my channel. This is your girl Melissa. I want to say thank you guys for tuning in to my last video. In this video I am going to tell you how you can pass your exam or your test. We all get that anxiety when test is coming up. We all kind of stressing ourselves out and we're doing a lot, but I want to mention this to you guys so that you can better prepare. I am going to be talking about ways to pass your test, how to pass your test. What is the trick to passing the test? Nursing tests are super hard. They are very difficult to grasp if you haven't learned anything, and also it requires a lot of critical thinking. So that's the one main thing, is know that nursing questions are all about critical thinking, and they're all about teaching you and getting you ready for the NCLEX, which you have to take at the end of the program in order to receive your degree. In order to pass a test, you want to be able to review anything that you learned in class after the lecture. Okay, that way you can retain the information way more and you'll be able to understand it when you have to review. When your teachers say you gotta practice your questions, you really do. You gotta do practice. You gotta practice every subject that you learn. Do any type of questions. You can retain more information and it will definitely help you with the test. There are a couple of things that I've noticed when I was taking the test is that they like to talk about risk factors. So you definitely need to know your risk factors. When you're studying, pay attention to the risk factors. Risk factors could be age, health, race, sex, which is male or female. You want to learn about what is the thing that can cause the most harm to the patient. And what I mean is that NCLEX questions, I've noticed, and even nursing questions, like the answer to the question is usually the one that is deadly. That's a trick. If it's deadly, most likely it will be the answer to that question. What is the complication of this? And then they're gonna give you all these answer choices, and the most likely be the deadliest one, because that's what they're testing on, is that whether you know what you need to really watch out for. So yeah, then you don't want to assume a lot with the question. If you're creating a scenario, then you most likely will pick the wrong answer. You want to answer based on what the situation is talking about. Do practice on priority questions. Your priority questions are very big in testing. They like to test you on, do you know how to take care of someone who's really sick? Priority questions are basically, what do I do first? What patient do I see first? And the way to answer that is basically stable versus unstable. You want to take care of the unstable first. The stable patient, they'll be fine. You can see them like in 20 an hour, they'll be okay. Priority questions are the ones that you need to really practice on, because they ask a lot about that, like what can happen if I don't see this patient first, type of thing. Another way is to do your ABCs, and they're like your essentials. So you're gonna have your airway, your breathing, your circulation, and those are the top 3, and they usually are the ones that you will use in order to answer your priority questions. So in order for you to really pass your test is to do practice questions. All your questions will have those risk factors, those complications, and you also don't want to assume anything, and you want to answer the priority questions. So if you need to practice on those, definitely practice. Thank you guys for staying in tune with this video. Thank you for watching this. I hope to see you guys next time. Don't forget again to like, subscribe, and comment on this channel. So I will see you guys next time.